produce girls. So apparently I'm only allowed one flavor per generation.
Really? So three is going to be it. You're not expecting any more
I
uh
have one
grand-
son that's holding out. He and his long-term girlfriend can't decide what they want to do as far as life is good right now. They don't see any need to change it, but maybe that they're our last hope, honestly, because if he doesn't have a boy, then there's a big black line at the end of the family tree. My husband will be the last Wilton, so
yeah.
we're holding that hope.
Yeah, that happened with my dad. My dad also, because he had two girls and then his brother never had children.
Yep.
Yeah. Well, my dad was all right with it, I think.
Well, we're big on family names in my family, so I'm sure the Wilton will get passed around as a first or middle name too, if it comes to that.
Okay, guys, the link is posted. You're good to go.
Okay, great. Good morning. A meeting of the Louisiana State Board of Medical Examiners Occupational Therapy Advisory Committee pursuant to lawful notice is duly convened and called to order at 10:03 a.m. on Friday, December 13th, 2024 via Zoom virtual video. Please note any comments by the public are welcome and can be emailed to publiccomment@lsbme.la.gov. Ms. Wilton, could you please confirm that you have verified the identity of all tele and video conference participants?
Yes, we have. And I know it looks like Mary is not able to connect her audio, but hopefully she will. It's just stuck on connecting to audio, but
Okay, shoot. Um, is the sound clear and audible to the public and
yes,
those?
it is.
Okay. All additions to the executive or public agenda must be made presently, as we will no longer make additions to the agenda after the close of the public session. I'm now going to review the mission. The mission of the Occupational Therapy Advisory Committee is ultimately to protect the public, i.e. the consumers of occupational therapy, by regulating competent practice and upholding the standards set forth by the governing rules and regulations. Members present are as follows: Ingrid Frank, Amy LaRiviere, Kathleen Norcross, Raylena Crooks, Carolyn Murphy, Kimberly Solari, and Mary Green Keys. Amy, can you confirm that we have a quorum?
Yes, ma'am.
All right.
And
Also,
did
yes.
you say Kathleen or did I just miss it?
I thought I did say Kathleen Norcross, but
Okay,
we'll.
sorry. She said you, okay, my bad. Sorry.
Also present at the meeting are Amy Christo, Program Specialist, Tracy Morrow, IT Technology, Sandra Hawkins, LSBME License Analyst, Phyllis Johnson, licensing. Wait, is Phyllis on?
Nope,
Actually,
not yet.
No, she won't be joining us.
Jacinta, are you on?
I am.
Jacinta Duhu, LSBME Executive Staff Officer. And Patricia Wilton, LSBME Executive Counsel. I think I got everybody. So we'll start with old business. I guess could we go ahead and get the screen shared with the minutes from November? Or I can do that actually. I guess I don't know why I'm asking for someone else to do it. Hold on.
I gave you everybody has the ability to share. So if you
Yes,
or
I do have that. I
your
just
Amy wants to show it, you can.
uh, why am I not seeing? No, that wouldn't be it. Give me just a second. I'm struggling to find the right thing. I know that I'm not sharing the right thing yet. Um, Okay, I should be sharing the agenda now. Is that correct? Carolyn, you can, yeah, okay, great. All right, so we met in November. We reviewed minutes. We went over some some communication barriers and agreed that the chair would meet by phone with Dr. Van a week or so after each meeting, which by the way has happened. We looked at we got an update from Dr. Van about the rules and regulations. We learned why the advisory opinion on telehealth had not been published. It's because the board wanted to create rules around it. We got information that we will not be able to waive background checks for CODAs who become OTs. We talked about the law. We first discussed and then voted on agreeing for a change to our law so that temporary permits are not, well, the difference will not be that they shall be permitted, but may be permitted. We clarified client evaluation without a referral, and we did go into executive session. So can I get someone to motion to approve the minutes from our last meeting?
Can I ask a quick question? Patricia, do we need to change Dr. Van to his full name? I mean,
That's a
I
good
mean,
question.
is that on anything? Like, would anybody know who Dr. Van is?
Oh, I see what you mean. Vincent Collado, Executive Director, sure.
I mean, I don't know. I'm fine with it the way it is. I just wondered.
I agree with you. Yeah, Amy and I'll have to do better about giving his real name.
But other than that, I think it's great and I approve it. Our
Okay,
motion to approve, I guess.
all right, Carolyn motion. How about a second?
I second Kim.
All right, all in favor of approving the minutes, say aye.
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 Aye. Any opposed? Okay, the minutes have been approved. And do we have any public comment?
No, no public comment to date.
Let's go back here. So our first new business is to get an update on the status of our rules changes, which was going to be from Dr. Collada, but I assume Patricia, you're going to give us an update on them?
Yes, if I'm not mistaken, those have been submitted. I tell you what, come back to me. I'm gonna look on the dashboard real quick. I
Okay.
can't remember if they've been submitted to the register yet, but I can find out while y'all are talking about something else.
Okay. So as we talked about at our last meeting, our advisory opinion about telehealth did not get published because the board felt first we had to have rules to back up something like that. And so the board did create rules based on our advisory opinion. I have not reviewed them yet, but they're on here. So we're about to do that now. We're going to review the rules regarding the use of telehealth. Let's see here. Is this it? And let me see if I can make it bigger too. Yes. So here are some updated rules regarding telehealth as opposed to telemedicine. And it looks like the things that are underlined are probably what's new. So it got added here. The rules of this subchapter govern the use of telemedicine by physicians, and the use of telehealth by allied health professionals. Here's a definition: healthcare provider, a person, partnership, certified by this state to practice medicine or provide healthcare, or healthcare professional which may be provided by telehealth in the ordinary course of business or practice. Looks like they've added a definition for telehealth. Means healthcare services, including behavioral health services, provided by a healthcare provider, as defined in this section, to a person through the use of electronic communications, information technology, asynchronous store and forward transfer technology, or synchronous interaction between a provider at a distant site and a patient at an originating site, including but not limited to assessment of, diagnosis of, consultation with, treatment of, and remote monitoring of a patient and transfer of medical data. The term telehealth shall not include any of the following: electronic mail messages and text messages that are not compliant with applicable requirements of HIPAA, and fax transmissions. Looks like they've added telehealth permit to telemedicine, a permit issued by the board in accordance with these rules. Patient relationship. Telehealth shall not be utilized by a healthcare provider with respect to any individual located in this state in the absence of a provider-patient relationship. The use of telehealth, it looks like they went back really and just changed medicine to telehealth to encompass everything. A healthcare provider shall not be required to conduct an in-person patient history or exam before engaging in a telehealth encounter, but shall provide a referral to a healthcare provider in this state or arrange for follow-up care in this state as necessary.
I have a question.
I don't understand this one.
So on A, where it says you have to have let's see, shall not be utilized in the absence of a provider-patient relationship. I don't understand what that means, and it seems almost contradictory to B, but maybe I'm just reading it wrong.
Contradictory to B in the sense that B says you do not have to have had an in-person visit before doing
Right.
it. Yeah.
Yeah. So I'm not real sure if I'm.
I guess a provider-patient relationship, maybe. I wonder if that's in the definitions. But
Maybe.
I
Let me
think
look.
Is it saying like a face-to-face with the physician before?
I think it just means that that there's like, for example, a provider-patient relationship for an OT would come about through having had a physician refer the patient to the OT. Or
That's what I think. That's what I think it means. It means some kind of pathway. What are the dots connecting the patient to the provider?
Okay.
and it happened to have been if it's one of our things that don't require a referral, like a wellness, some of the things we have that don't require a referral, then I think there would still be that assumption that you're on this telehealth visit with this person for this issue.
To engage services for that. Yeah. It's kind of like on the TV when you see, give me $1, now I'm your lawyer kind of thing, So it's just an understanding between the patient and the individual and the provider that we are now in the provider-patient relationship.
So this B says that we don't have to have had an in-person first, I guess my question was more the second part, but shall provide a referral to a healthcare provider in this state or arrange for follow-up care in this state as necessary. Patricia, do you know what I don't understand where that one's going or why we have that in there. Or what
So I think the legislature is the one that said you don't have to have the face-to-face. Even though at the end of the day, it still always comes back to the provider. You have to provide the same, like we talked about when y'all did your rules, you have to provide the same level and quality of service that you would if you had a face-to-face visit. So it doesn't mean just because you don't have to doesn't mean you can't, and it doesn't mean you shouldn't when the circumstances arise. This appears to be conjoining two different concepts. One is that you don't have to have a face-to-face visit, but if in the provider's view, or honestly even the patient's view, that some kind of face-to-face in-person either evaluation or follow-up is warranted, that telehealth provider has to facilitate that for the patient.
Okay. So, which is kind of the same thing, I guess, as in our regular rules, that if we meet a patient and realize they need follow-up with someone else, that it's our responsibility to facilitate that.
Right.
Okay, location of participants. A physician using telehealth may be at any location. I wonder if this should be healthcare provider, Patricia.
Yes, probably. Yeah, because I'll make sure that change. Well, actually yeah, I'll make sure that gets changed.
So I will say a healthcare provider using telehealth may be at any location at the time the services are provided. A patient receiving medical services by telehealth may be in any location. Disclosures. The practice of medicine is deemed to occur at the location of the patient. Therefore, no physician shall utilize telehealth to provide medical services to patients located in this state unless the physician, I guess all of this needs to be healthcare provider, holds an unrestricted Louisiana license, holds a telehealth permit as provided in number 408 of these rules. Utilizing telehealth, a physician utilizing telehealth with respect to patients located in this state shall have access to the patient's medical record. If required by the standard of care applicable to the diagnosis or treatment of the patient's complaints in a traditional face-to-face setting, the ability to utilize peripherals such as an otoscope or stethoscope to obtain diagnostic testing, if necessary in the physician's judgment, to access a patient presenter, to assist with the telemedicine encounter, and D, to refer the patient to another physician in this state as indicated. Well, some of this feels like it should be healthcare provider, and some of it seems very specific to being a doctor.
Yeah, I think what happened is Lauren did a lot of the drafting of this. I think what happened was originally they were going to put telehealth provisions in every discipline. And then when they sat down to do that, they thought that is crazy. It's unwieldy. We'll have one telehealth section that applies to everyone. But it's not a perfect template because not everything applies to everything. So I'm making notes right now to go talk to her next week about how we differentiate between what applies solely to physicians just because of the nature of their work vis-a-vis the nature of other providers. But yeah, universal things should say healthcare provider. Things that aren't universal should say physician, but we have to somehow alert the public to why we're saying one versus the other.
Under B, letter B, oh, well, big letter B, small letter C, to access a patient presenter. We did talk about that in our advisory opinion, that sometimes it might be necessary for the patient's safety to have somebody with the patient. And we didn't use that term, but I think that's what they mean, though.
Yes.
Okay. I mean, we would sometimes maybe need to utilize peripherals also, though not an otoscope.
Right.
But that doesn't mean, like, sometimes it is appropriate to take blood pressure. Sometimes it is appropriate to use a goniometer or any other number of things. Okay, disclosures. Prior to utilizing telehealth, a physician shall ensure the following disclosures have been made to the patient and documented in the medical record. Such disclosures need not be made or documented more than once. The name, the Louisiana medical license number, and contact information of the physician, the specialty or area of practice, how to receive follow-up and emergency care, how to obtain medical records or ensure transmission to another provider, how to receive care in the event of a technology or equipment failure, and notification of privacy practices. Quick question I have about such disclosures do not need to be made or documented more than once. Does that mean that at the first telehealth visit, you can provide all of this information? My name is Ingrid Frank. I'm an occupational therapist. This is how you get in touch with me. This is my area of specialty. This is how you can get emergency care if you need it. But after that, on any subsequent telehealth visits, I would not need to repeat all this.
That's right. Although Prudence would say, do you remember the information that I gave you at our first visit regarding such and such? Do you have any questions or do you need me to repeat that? Something like that, just as a matter of practice. And then, of course, if a different person ends up seeing that same patient for whatever reason, you refer them to, you have somebody else working with you or for you or standing in for you. They, each new person would have to give them, their personal details.
Okay. All right. Patient records shall be created and maintained for every telehealth visit according to the same standards of care as an in-person visit. The record shall clearly reflect that the encounter occurred by telehealth. It needs to be confidential and subject to all applicable laws and regulations. It needs to be accessible by a patient and the physician. It needs to be made available to the patient or a physician to whom the patient may be referred. And it needs to be able to be made available to the board upon request. Privacy and security. Only secure communication technology shall be used for telehealth. At a minimum, telehealth technology shall comply with all state and federal laws and regulations for health information privacy. Informed consent. In addition to any informed consent and right to privacy that may be required, physicians shall ensure that each patient to whom they provide medical services by telehealth is, one, informed of the relationship between the patient and the physician. Two, notified that they may decline to receive services by telehealth and may withdraw from such care at any time. That's good to have. Prohibitions. The following prohibitions apply to physicians who practice medicine in a state or controlled substances. That's not us. No physician shall utilize telehealth for the treatment of non-cancer related intractable pain, for the treatment of obesity. Really?
Yeah, some of those are a little bit antiquated. Those are in our existing rules for physicians. They can't, there are strict requirements about how you treat non-cancer related chronic pain and obesity. Probably that's going to change, at least as far as the obesity rules, because that field is burgeoning so much, and those rules are really outdated. But yeah, that they're just pulling that in from those rules.
Um, I get it from the pain thing because of the potential abuse of pain medications. But I think it would be appropriate for an occupational therapist to possibly work with a person whose primary issue was obesity via telehealth. That would not, I mean, don't y'all think that that would be appropriate? Yeah, I don't think that would
Yes.
anything that an OT would feel like it's not right. So I guess we would like to see that change.
Okay, I'm writing that down.
Okay, 3, we don't do anything with controlled substances. Um, the 4 is still about that. Okay, D, a physician who practices telehealth by virtue of a telehealth permit issued by the board shall not open an office in this state, meet with patients in this state, receive phone calls in this state from patients, or engage in the practice of medicine in this state beyond the telehealth permit. I guess I'll have to back up and ask Patricia, what is the telehealth permit? Are OTs going to have to get a separate permit in order to see a patient by telehealth?
An out-of-state OT would have to. I mean, we don't actually have a way for them to do that.
No,
These are for out-of-state physicians who only want to do telehealth. They don't do any in-person patient. They don't have an office here. So we don't make them get a full and unrestricted license, but we make them get a telehealth permit. But
okay.
but we don't have a mechanism for that for OTs. And
We
if you're licensed in state, you can do your telehealth
uh,
regard.
regardless,
You
without
don't
okay.
have to have a separate, you don't have a permit because you have a license.
I would say that we probably do need this telehealth permit for out-of-state OTs. I have no idea if out-of-state OTs are providing telehealth in our state. I do know that there are OTs in our state whose entire job is to provide telehealth to people out of state. Like I personally know an OT who works in the school system in California, but lives
Okay.
right here in New Orleans. So because I know that there are OTs here doing that elsewhere, there's bound to be OTs elsewhere that either are or would want to do that here.
Okay. Well, they can't be doing it here legally right now, but if we want to make a pathway for them to be able to do that, we certainly can.
I would want to, if only because I would be surprised if someone's not doing it illegally already.
Yeah. I mean,
Agreed.
it's, it's to the extent that they went the direction of putting this as a global telehealth regulation that applies to all types of providers. They probably need to examine whether they want to have a permitting scheme for out-of-state providers other than physicians. So I've got that in my notes.
Okay, great. And so what this letter D is saying is if an OT from another state got a telehealth permit, was providing telehealth here in Louisiana, that person would not be allowed to open a physical office or meet in person with patients in this state.
Correct. Because if that's what you want to do, you just need to get a license, a Louisiana license.
Okay. Okay. But if they got a Louisiana license and still stayed out of state, then they could do both.
Correct.
All right. No physician shall supervise, collaborate, or consult with an allied healthcare provider located in the state via telehealth unless they possess a full and unrestricted license to practice medicine in this state. So that's That's physician specific. F seems like, again, it needs to be healthcare provider. No healthcare provider, it seems like, shall utilize telehealth to provide care to a patient who is physically located out of this state, unless they have lawful authority to do so by the licensing authority of the state in which the patient is located. Exceptions: furnishing medical assistance in the case of a declared emergency, issuance of an emergency certificate, a true consultation, for example, an informal consultation or second opinion provided by an individual licensed in a state other than Louisiana. Action against license. Any violation or failure to comply with the provisions of this chapter shall be deemed to constitute unprofessional conduct and conduct in contravention of the board's rules, as well as violation of any other applicable provisions, and may provide just cause for the board to suspend or impose restrictions on a license for a physician, allied health professional, as the board may in its discretion determine to be necessary or appropriate. Action against a permit. So this would be, I guess, for an out-of-stater like we were just talking about. And this, they do include allied health professional here. For non-compliance of any of this chapter, the board may suspend or impose probationary or other restrictions on any permit held or applied for by a physician or allied health professional, as the board may in its discretion determine to be necessary. Unauthorized practice. Any individual who utilizes telehealth to practice in this state in the absence of a valid license or telehealth permit shall be deemed to be engaged in the unauthorized practice of telemedicine of their respective field and subject to penalties. So is that pretty much it?
Yes.
Okay. It does clarify, I think, some of the things that we had wanted in our own best practices. For example, I actually have to pull up our own best practices so that I can know what's kind of missing. Give me just a second. We also have to, are we going into executive session today for sure?
Sandra, do you have anything for executive session?
Yes, I have two agenda items.
Okay.
After we finish this, we might need to go into executive session because I know Carolyn will have to leave. So
Okay.
that's why I was asking. So we might have to change up our order of things. But let me just get okay. Oh, I think it's already there. Are you guys seeing OTAC advisory opinion? Okay. So this was the draft we had made. Well, yeah, actually it's not a draft because we had voted on it. Appropriate use of telehealth. Well, we specifically referenced about the AOTA, that the AOTA emphasizes the requirement that the OT assess each client on a case-by-case basis to determine if the client will be best served by an in-person versus a telehealth session. There's nothing really like that in these rules, other than that the quality can't be degraded. Specific considerations. This also is from a lot of things from the AOTA about complexity of the patient, their context, the complexity of the intervention. I mean, none of this is really in those rules that we just read through. I don't know if that means we would not be allowed to have this a kind of an advisory opinion because there's no rules that talk about this specifically.
No, you're advising on best practices, and so that's perfectly fine to enhance and explain and expand upon what the bare minimum is that's in the rules, which is don't sacrifice the quality of the interaction.
Okay, great. And then finally, in the client safety, we had called that assisting person an e-helper, and that is referenced in the new rules as something else. I forgot the term, but we can,
Patient presenter, I think, something like that.
yeah, was it patient?
Yeah, I think that's what it was, patient presenter.
Patient presenter. So we could change the language in to match.
I can search my document. I have it open.
And now I've lost the advisory opinion.
Yeah, patient presenter.
Well, somehow, oh, there's the advisory opinion. Okay. Whew. Lost it again.
Are you looking for that term, Ingrid?
No, that I was
Oh.
trying to get back to this advisory opinion. So
Oh.
patient presenter.
I'm
So
sorry.
we could change this to will frequently result in the need for an in-person support person, or what did we just call it?
Patient presenter.
Just so it's the same language. Okay. All right, so let's see if there was anything else. Client safety. Other back practices, being proficient in use of technology, verifying the identity of the client. Some of this was covered in the new rules. Alternative means of contacting the client if the communication should stop. Using only HIPAA compliant, that's in there. The talking about informing them of the disruption of electronic communication. Obtaining verbal consent for telehealth, documenting this. HIPAA. Clearly document that it was done through telehealth. That was in the rules. Have a procedure in place to address clinical emergency. That was in the rules too. So the only thing that would need to be added here is really to make that to advise that you the best practice is to go over all of this on your first session. Subsequent sessions, you can just ask, do you recall the information that we went over last time? And then if a different OT sees the person, then they need to go back over all this again. All right. Well, thank you for providing the rules so that we could take a look at them ahead of time. And on our next meeting in January, I guess we'll find out if some of the language was changed to be more for OTs in addition to just physicians.
Sure, I'll do that. And while we're still talking about the status of things, all of the documentation, the necessary documentation for your rules has been submitted to the Office of the State Register. I believe it'll be published in the December Register, but if not, it'll be in the January.
Fantastic. And at what point would you estimate that it would be open for public comment and for changes to be made to it?
It's done. It's done. Once it's I think they have a like 30 days. I can't remember that. I have it all on a spreadsheet, but they have a certain amount of time. If nobody asks for a public hearing, then we don't have, actually it's like if 5 people or more don't ask for a public hearing, we don't have to have a public hearing. And if we receive public comments of any kind, those are forwarded to the board and they can consider them and either adopt them or do nothing or what have you. So the time frame gets pretty short from here on out.
Okay, so kind of this open comment period wait, I'm sorry, I can't remember if you told me that it had been sent for publication. Oh, you said it was going to be published in December, you think?
I think December. I think she got it in under the wire.
Okay.
But if not, it'll definitely be January, but I'm pretty sure it'll be in the December
And
register.
if it'll be in December, then from the moment that it's published in December, from there, that's when we kind of have
Yeah.
about the 30 days.
Yes.
So one thing that we realized was with this change in the upcoming change with the law regarding temporary permitting was that the language we put into our rules might need to change now, because in our rules, we definitely imply that you can get a temporary permit just because you're a new graduate and you're waiting on and we're not really going to be allowing that anymore. So do changes to the rules include us? Like we also have 30 days from the point where it's published to make that change? Make any changes?
I think we would have to treat that as a public comment, and the board would then choose to change it based on that comment. I'm gonna have to research that.
Okay, and I also don't know when that law language is going to change, because that was something Dr. Van was handling, and I don't know when that's going to go through.
Right. I mean, clearly it's not the law right now, so
Yeah.
and we would, I mean, I think we probably won't worry about it for right now. And if we need to
Okay.
go in and make that one little technical change, that's an easy fix in the future.
Okay. All right, well, I think we should go into executive session now. And the last thing was to talk about our temp permitting language and what we would want that to look like. But we may or may not need to do that right now. But let's see, executive session. Okay. So we do have an investigative matter related to licensure that requires executive session. Can I get a motion? And Patricia or anybody else, correct me if I'm doing this wrong. Can I get a motion to enter executive session?
That's correct.
I motion Carolyn to enter
I
executive session.
second Kathleen.
All right, and Kathleen seconded. All in favor of moving into executive session, say aye.
Aye.
Any opposed?
Aye.
Any opposed? Okay, we will now move into enter executive session at 10:46 a.m.
Okay, just give us one
Just a
second.
minute to set up the room. You got that message to join, you can go ahead and join.
Hello, Tracy.
Well, good morning. How are you?
Fine. Is OT over?
No, they're in executive session.
Oh, okay.
Do you need to go there? I can text Jacinta.
Well, whenever they let me in, they'll let me in.
Yeah, I don't know if she knows you're on. I'll let her know.
What can I say?
Just went over, I guess about 5 minutes ago. You feeling okay?
I'm getting a little something, and I'm staying at home, taking antibiotics and resting so I can get better. I called the doctor this morning and try to do what they tell me to do.
Yeah, you sound like you're a little nasally,
Yeah, a little raspy.
a little raspy.
Hey, what are they doing in their meeting? I'll join.
Oh, yeah, they're in executive session. Uh-huh, uh-huh. Oh, no. Where at? Prostate. Uh-huh, right. It metastasized. It metastasized. The spread, yeah, that's terrible. Terrible, terrible. Sorry to hear that. Oh, okay. I love you too, bro. Be careful. All right, baby. Okay. It won't stop. Wait a minute, so where are you? You're at home? You try to close the app? Hold on, let me see. Gary, where to close it? Oh, wait, you have a service, so the board machine. I think you have a service first, you get the board machine, not a home machine. Okay, here. Come on. Oh, so here, right click here, so exit. Okay, so always right click on it and go to exit, or when you open it, you have to click on connect and then exit. You can't just close the X. All right, you're welcome. Bye.
Okay, we are back in public session. In the matter of tracking ID number 302257, the Occupational Therapy Advisory Committee will take a vote on moving to approve a license to this person, subject to them completing 120 hours of shadowing of an occupational therapist. I think that's all I had to say. So can I get a motion to approve this recommendation?
I will, Amy.
And
I'll
to
second.
all right. All in
I'll
favor,
second Kathleen.
all in favor of approving the recommendation to license this applicant subject to 120 hours of shadowing of an occupational therapist, say aye.
I,
Aye.
Any opposed? Okay, so then,
And Madam Chairman, you had no public comment at this time.
thank you. In the matter of tracking ID number 307479, the Occupational Therapy Advisory Committee will vote to move to recommend that the test requirement number for the NBCOT exam be waived and that this applicant be allowed to be licensed to practice in Louisiana. So can I get a motion to recommend that the test number, the NBCOT test exam pass number be waived for this applicant?
Raylene, I'll make a motion to waive the test requirement.
Okay, and to second that?
Kim.
So all in favor of moving to recommend waiving the test requirement and allowing this applicant to be licensed in Louisiana, please say aye.
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 I,
Any opposed? Okay,
Any public comment?
any
No
public?
public comment at this time.
All right. Very good. The last thing that we had on our agenda was to look at the temporary permitting language in our proposed rules. But Dr. Van, one thing we were talking about was the law has not yet changed regarding temp permitting. So is it appropriate for us to look at the language we put in our proposed rules?
No, you don't need to change anything in your proposed rules. Because right now it's mandatory. It's the law says we shall. We're going to change that to the board may, and then we'll use it only in extreme circumstances.
Okay, so after it becomes may, I guess at that point it might be appropriate to look at the proposed rules, just because I think it's going to be confusing. The proposed rules are going to imply that you can get a temp permit. And so I'm concerned that occupational therapy practitioners will be confused by this. But if it's more appropriate to just wait on this until the law has actually changed and then separately change, look at our rules, we can do it like that.
I think that would be the best thing because if we have to change a rule, it's just going to be one or two words in a sentence.
Right.
Okay. All right, then we don't have anything more on the agenda. Our next meeting will take place on Friday, January 31st, 2025 at 10 o'clock a.m. via Zoom virtual video. Is there any public comment?
There's no public comment at this time, ma'am.
Okay, then our meeting is adjourned at 11:15 a.m. And happy holidays to everybody.
Merry Christmas and thanks for all you
Merry
do for
Christmas,
the
happy
board.
holidays.
Yes, I hope everyone has a great next month and a half. See you in late January.
See you next year.
Yeah. Bye.
Have a good weekend.